So that's why it's important if you install a tourniquet, you take a Sharpie. So with that tourniquet, every tourniquet should come with a Sharpie. If it doesn't have a Sharpie, make sure it's part of the kit, because you want to write on the skin.
Hey, Matt Patrick Kelly here, and this is the first time ever I have a repeat guest. So Shane Eastman, thanks, brother, for coming on.
Absolutely. I'm glad I could help you out here. That's awesome.
So Shane was on my Knight's Path podcast, episode 6, and that aired May 22nd. And we talked a little bit about what he did over in the sandbox. And that's kind of why I wanted to bring him on again today, is because Shane's got some experience, and there's a lot of classes out there, stop the bleed, tourniquets, and if you're going to carry a gun and be responsible, I wanted to just talk to you about some of the things you've seen, some of your opinion, your expertise, sucking chest wounds, and should a tourniquet be part of your everyday care?
Yeah, absolutely. Short answer is yes.
Yes. So
yes.
Talk a little bit about what, I know we hit it on the podcast, but you were over in the sandbox, and you were basically a battlefield surgeon.
Well, that's a little, that's very generous. Basically I was a emergency medic working in the basically the famous Trauma Bay 2 within the Balad Hospital there. And we would treat and do level 1 trauma care in the desert in a tent. And in order to do level 1 trauma care, you had to have a neurosurgeon and plastic surgery on location, which we did. I mean, they were literally doing neurosurgery in the field in these tents. And, we had the highest acuity in the world. And just to kind of break it down, what acuity is the level of, or the volume of patients you get matched with the complexity of, so we're not talking about someone who stubbed their toe, right, and you get 4 or 5 of those. We're mass cows, which is basically 25 patients or more that are critical in an hour. And we would routinely do that. And there were times where, in here stateside, there's a thing we call scope of practice, staying within your skill set or whatever. Well, when you're it. And the doctors had the wherewithal to say, you guys are really talented at what you do. It might be a good idea if you had a few extra skills to when the stuff hits the fan. And so, we of course learned several, as part of our training anyway, some advanced pre-trauma hospital life support and so forth. But we built upon that while we were over there, and to the level of, starting chest tubes and, being able to start central lines if we needed to, everything we really need to do. And of course, a lot of it I kind of learned stateside anyway, working with the doctors that were learning in the ICU and such. But it was not uncommon. I'll never forget the day, July 7th in 2007, 777. How about that?
Yeah.
And that day was a day of hell. And anybody who was over there during that time will remember that day, because we had 2 mass cows back to back. It was first thing in the morning. It started off right out of the gate with a crazy incident where I'm going to now, but then the mass cow started, and we had at one point, one of the many doctors, of course, all the doctors, even if they're off, they get called in during these events. But there's so many patients, so there aren't enough doctors to go around. So they're like, okay, this is your patient. You keep them alive, do what you got to do. And, we're cutting off arms, getting them intubated, getting him to CT, getting him prepped for surgery, and getting him to surgery in time in order to really get the life-saving measures in place. But we just get him stabilized enough to get him to surgery. And what's a really awesome stat, Matt, is, and it's a kind of a double-edged sword, really, because if you came through our doors with a pulse, you had a 98% survival rate at that point.
Wow.
The team was, and that goes to the surgeons. That credit goes to the surgeons. It's amazing what they did. And, we had such a talented group of people right from the door, from the pad personnel to, the technicians and, just the whole team. And we worked together in such amazing concert. Well, during this day, in fact, I suffered from PTSD from that day, because at one point I was so busy working on my patient, getting him ready and getting ready to go to CT, I stopped and I looked up, and it was nothing, no joke. This is no exaggeration. It was a sea of red, and it was just body, just all covered in blood. All their DCUs were just completely drenched. And I was just like, wow. It's like, when did all these patients come in? And because I was just so busy,
right.
Because you're so focused on your own chaos, you don't even see it.
Right.
And, but yeah, so we're rolling, and it's funny. There's actually, by happenstance, video of that moment of me looking up going, holy shit.
Wow.
I was like, in my head, I didn't say it. I was just like, holy crap, what is going on? And meanwhile, I get the patient to CT, and they survived. The patient did well, got the right life-saving implements in place, and they actually turned out quite well. They were talking before they even left.
Wow.
Because they were in really bad shape when they came in.
I never asked you this, Shane. Did you ever meet with some of the folks that you'd helped after the fact? And did they thank you? Did they know?
No, and that's not common.
Okay.
I mean, there are some people, like patients, that, man, I wish I could catch up with them. Like, there was a Delta operator that he came in, and he had a knife to his head. And I don't know if you want to actually go into that story. That's kind of a little more involved story. And maybe that's a whole nother episode. Yeah, we might have to talk to that one. But he came in, and I'd love to catch up with him. He was a high dollar asset, but he reminds me of you. I mean, just the same great jovial personality, but he had a knife to his head.
Was it stuck, embedded?
Yeah, he was stabbed.
Oh, wow. Okay. Yeah. This is a crazy.
So we'll come back to that. We'll go to that. We'll do another episode on that one. So your viewers.
You'll be my three-peat. You'll be my first three-peat, man.
Yeah. So, there we go.
That's awesome.
But anyway, so yeah, there's a lot of stuff. Basically that 6 months was probably the most intense 6 months of my life.
Oh, I bet.
That during that rotation, because it was just so active. There was just never a dull moment, unfortunately.
No. So one of the, and I watched, like a true interview prep. I watched a few YouTube videos, to get smart, to ask you some smart questions or whatever. Right. But tourniquets nowadays are really used to control hemorrhaging. And back in the day, like when I grew up, it was like, if you used a tourniquet, you were basically going to lose that limb from there down. And that's not necessarily the case these days, right?
That is absolutely correct. That was old school thinking, and that changed. Oh gosh, I think that changed around the early 2000s.
Okay.
And when they really started figuring out that, okay, maybe it's not a bad idea to, actually it was about 2004 when that war really started kicking off. They really started figuring out, tourniquets actually aren't that bad. That being said, there is a time limit though.
Okay.
So, so that's why it's important. If you install a tourniquet, you take a Sharpie. So with that tourniquet, every tourniquet should come with a Sharpie. You know, if it doesn't have a Sharpie, make sure it's part of the kit, because you want to write on the skin the time you are installing it.
Holy crap. I was thinking Sharpie, like, you know, if you use that as you use the Sharpie and it has its own winding thing on it, right? And you use the Sharpie to write. Okay, so what are you supposed to write?
So you write T, and then the time you actually wrote it, you're actually installing it.
Okay.
And try to use military time, so there's no question.
Okay, holy crap, this is valuable. Yeah. That's great, Shane.
Yeah, because there is a time limit on when, yes or, you know, is it a life-saving measure? Yes, you got to definitely, it's better to bleed out and lose a limb than it is to, I mean, you know, not bleed out and lose a limb than it is to bleed out and just keep a limb that's, you know, no good to a body.
Right.
So, but definitely write the time on there, so that way the receiving ER doctor can treat appropriately when they come through the door. And because they'll get that in report, either being life flighted or whatever, the doctor will know, and they're calculating, you know, ETA, okay, and they'll already have in their mindset, you know, what they need to do as soon as they come through the door. So that'll help equip the doctor as well.
That's good.
That's what's most important, you know.
Yeah.
So yeah.
Okay. The other thing I heard, and this is kind of old school thought as well. And so it used to be you would want to use a tourniquet on the upper arm, and you'd want to use the tourniquet above the knee, because it's one bone versus two bones in your leg and two bones in your arm. And there was a myth back then that you couldn't get a good enough cinch on the two bones in your lower arm or on your lower leg to be able to apply tourniquet appropriately. But that since, I believe, has changed as well, correct?
Yeah, you're better off, especially with a lay person installing the tourniquet. You might as well go with the one bone.
Go with the one bone? Okay.
Yeah, just go with the one bone with a lay person. If you really know what you're doing, there is right positions, and where you put the cranking mechanism does make a difference.
Okay.
Where a single bone, it doesn't make as much of a difference. You want to put it on the flatter part of the muscle, the arm, if you will.
Yeah.
And so basically, if you look up here, you want to put it on the side, is where the cranking mechanism is.
Okay.
And such. So, but you know, for a lay person, I mean, is there a more appropriate place? Yes, but let's not confuse people. Let's keep it simple.
One bone. Okay, good. Yeah. The other thing I heard too, and you might have seen this, is like if people had long sleeves on and you couldn't necessarily determine where the wound was, you wouldn't want to necessarily start ripping stuff off and expose it, or would you? And you could just go up high as you could on material, because that's another thing too. It's like some people are like, should I do it on material? Should I not do it on material? If you know it's above wherever it's gushing and getting the long sleeve wet, then as long as you get it above there, can you do it on material? Or should you bare the skin or cut it away?
Well, you're going to want to cut it away and clean it away anyway, just to be able to mark. You need to mark the time of the tourniquet anyway. So,
okay. There you go.
But, you know, there are some steps before you go to a tourniquet, obviously. If it comes to it, then use it. But really, let's see about what you can do. Is it possible to, you know, elevate it, you know, above the heart, basically laying down and elevating the limb above the heart, putting a bandage over it, and
direct pressure,
it, you know, with direct pressure or whatever. Get a good, you know, good wad of bandaging, and then really, you know, wrap it up. And it's not necessarily as a tourniquet, but it's doing some, you know, getting direct. If that stops it, then do that first.
Right.
Let's not take a bazooka to a pistol fight if you don't need to.
Right.
And you know, just do some basic stuff first and see if that's doing it. But if it's like a a main arterial bleed, and you know, like, okay, a bandage and some gauze is not going to stop this. It's just, you know, it's a main artery. Then yeah, you're going to want to use basically, and then also the, you know, good indication is how distal is it, meaning how close to your hand is the wound. You know, will give you an idea on what level of care you're going to want to give. Because if it's at the very end of your hand, chances are you might not need a tourniquet. So, you know, just kind of use what's
So
appropriate
you
to the,
elevate direct pressure and
yep.
Okay.
And,
Gotcha.
you know, and if you're able to do that first and that works, then definitely go with that first.
So are there some other things, Shane, where like if like say I had a wound on my arm and you know I packed, you know, we wrap the crap out of it, we put it above my head. I mean, are there places I can press and try to stop like an art, or is that even worth it? You know, just put it on the wound.
Just treat the wound for the most part first. If you
Gotcha.
get to the point where that's not working, that's when the tourniquet comes into play.
Okay.
Because as you're trying to get out of the woods, or let's say you're in a hunting accident or some kind of accident or whatever, and the first responders or the paramedics, when they do arrive, you know, start taking care of, then they can actually start doing what they need to do. So,
Okay.
um,
So when do you suggest, if you're out in the boonies, you're hunting, you're cutting wood, you're camping, any place where there might be some axing, some, you know, cuts, whatever,
yeah,
it's good to have so what are some must-haves in your med kit? Tourniquet, Sharpie, some bandages, you know, what have you got? What are your must-haves?
quick clot if you can get it.
And that's that powder.
Yes, the powder. I mean, that by itself, and that's also another thing you might want to Sharpie too. You know, what at the time of the incident. But quick clot is phenomenal. I mean, it saves so many lives, you know, over there. And then of course, you know, it's being used a lot more now, stateside, you know, privately and stuff. But so get quick clot. That's definitely a must have. It doesn't hurt to have that in your first aid kit.
Okay.
And then you want to have some kind of, definitely you want to have some kind of thick, clear plastic
Okay.
for creating a what they call an occlusive dressing. And the reason why you want to have that's for treating like a sucking chest wound. Let's say you get a shot to the lungs, you know, just above your lungs or whatever. And so as you breathe in, your diaphragm contracts and then it sucks air in. And if you have a hole in your chest, it basically sucks air in there and it collapses the lung. Well, if you have an occlusive dressing, and what you do is you take tape, some really good medical tape. You don't use, I mean, you can use duct tape, really. I mean, that's, you know, any kind of good duct tape will work.
Yeah,
as
gorilla
long as
tape,
it's
whatever, right?
gorilla tape or whatever. But medical tape would be better. You tape it on 3 sides. And the reason being is because if pressure builds up within there, it has a place to burp up and burp out. And you want to do it from, you want to leave the 3rd side towards the bottom.
Okay.
Yeah, down.
So,
And yeah, so that way and you will have that person kind of seated, you know, reclined, you know, position. So that way the air, you know, any air or whatever can burp out and so forth.
Okay.
So and that's what you would do for like a chest cavity. I don't think we should go into talking about chest tubes or anything on how to insert those. That's
So on that sucking chest wound, is that just an entry with no exit, or is that with an entry and an exit? What if it's a through and through?
If it's a through and through, so what you're going to do is you're going to tape up and put an occlusive dressing on the back, tape all 4 sides.
Okay.
And get it nice and
So
secured.
seal that one completely, and then you'll have just the 3 sides on the front.
Right. Because
Okay.
them leaning back against whatever they're hopefully sitting against while they're being transported will keep that back tight and such.
Okay.
So Man, you're actually making me dig up some cobwebs. This is from 14 plus years ago, almost from that time frame. But yeah.
Yeah, absolutely. Okay, so quick clot. Now the medical tape, is that the clear white or the white tape that comes in a little spool that you pop out?
Yeah. Preferably you want to get like a 2-inch.
That's what I was going to say, because width, is there a preferred width? Because some of those are really skinny.
Yeah. No, you definitely want to have 2-inch, because if you want something narrower, that stuff rips nicely. It's basically medical cloth tape and or silk tape, I think is what they call it, the type of brand.
Medical cloth tape, silk tape. Okay.
Yeah. There's 2 different brands that we would use and whatever we could get our hands on, but 2 inches is best, because then you can have enough on the skin and have enough on the dressing.
Okay. And then a couple of ace bandages, some rags, triangle bandages, things like that for sling. Good to have something in there for a fracture, like if you were going to splint something.
Yeah, I mean, really, as long as you have the triangle bandages, you can almost use anything as a splint. If you're in the woods, use branches.
Right.
Get creative.
You can use magazines, phone books, any softbound books, whatever, right?
Yep. Anything that you can roll up and kind of create a rigid line, and you can tape to that or wrap to that.
So if you see bone sticking out, you shouldn't try to reset it, right?
No.
You just need to like wrap that shit as good as possible so it doesn't move and get any worse. But yeah, so yeah, tell me about a compound fracture. You see one coming out of the arm.
Yeah, basically you're going to immobilize it the best you can with a splint. And of course, you're going to try to stop the bleeding the best you can with the situation. You're going to wrap around any protrusion and just kind of leave it in place. And depending on like what kind of makeshift stretcher you're going to make, you can almost use that as well. And immobilize the limb and then immobilize the body as much as possible.
Okay.
Yeah, because every bounce or whatever is going to be pure agony.
Yeah. So let's see. I guess it depends on the situation. I mean, I could ask you these questions and you're like, well, it depends,
Yeah.
Should we not move them at all, or should we move them? And that just is going to depend on the situation, right? But can you think of a situation where it would be more harm than good to move somebody and you should just leave them and hope help comes to you?
So, well, do you have a signal to where you can call, some kind of emergency response team, and they will make the call and tell you what you need to do. Then if you can keep them stable or whatever, and it's close enough to where life flight can come in and pick them up and be able to load them up, and they can load them up and do everything that they need to do at that point. And really but if there's no cell phone signal, and you kind of have to use a judgment call on like, how much time do you have? Do you have time to get to where there's cell phone signal and then get back and then get that person out of the woods at that point? I mean, there's a lot of variables, and you just got to use best judgment at that point.
All right. So we got quick clot, we got tourniquet, we got tape, we got marker or Sharpie, we have scissors, or something to be able to cut away clothing, right?
Yep.
Triangle bandage. What else do you think? I mean, I imagine some like glow sticks or things like that, some kind of light source.
Water, hydrogen peroxide. I mean, carry as much of that as you can. Okay. I mean, if you're going to carry something, hydrogen peroxide is the really an unsung hero. It treats so much inside and outside, so forth. So,
does it hurt if you have some compound fracture to pour some hydrogen peroxide on there?
Well, supposedly you're not supposed to use, depends on who you're talking to.
Okay.
I mean,
Right.
but
Medical
yeah, I mean,
experts can disagree, right?
yeah. If it were me, I'd be pouring it on like there's no tomorrow. But you want to, the thing about that though, is when you put in hydrogen peroxide, is it's going to release the bleeding. So if it's already starting to clot, then no, don't use
Okay.
hydrogen peroxide. So
Good. That's good to know. All
yeah.
right. I hear this stuff about tampons and maxi pads. What the F is up about that? Should you use them? Should you not use them?
Absolutely. If you have them, awesome. Because they make for a great cover. Like a maxi pad, obviously absorb a lot of blood and so forth. But then the tampons, they do two things in a wound, especially like a gunshot wound.
Like put it in. If
yep.
You see, okay.
Inject it in, and and then you pull out the applicator, and then basically as it does two things. So basically it's in there and it'll expand, and as it's expanding, it'll help occlude the bleeding.
Okay.
So, but you're going to do that in arms and fleshy areas and so forth. Be careful about around your lungs and that kind of stuff, because if you push it in too far, and if it's an area that, depending on the angle of, let's say it's a gunshot wound, depending on the angle and how it went in, you want to not aggravate it anymore.
Right.
But if it's in your arm or a fleshy area, whatever, not a big deal. Just be careful of the lung cavity.
Okay. And of course, when we're talking about tourniquets, it's limbs. I mean, once you start getting something into the trunk, I mean, it's direct pressure and try to get some help.
Yeah.
Fast,
yeah.
Right?
Wrap it up.
Yeah.
Put clean dressings on as much as possible.
Okay.
And yeah.
How do you know when you hit an artery? Bright red blood and spurting?
Bright red, spurting, spraying. There's no joke. It's coming and it's not stopping. And but if it's kind of a slow ooze or whatever, that's vein, and it's a darker color red. That's not as life threatening.
Okay.
But you can die from a venous bleed, because depending on how much time you have, such. So
yeah, man,
all comes down to time.
Right. Exactly. You're leaking. You need to patch your holes. Let's see. Is there anything else I may have forgotten that you want to add to this? This is just kind of the other thing. I actually do have some questions. So, shock, how do you recognize when someone is going into shock? And then how do you self-recognize when you're going into shock? Because if you're by yourself and you're like, oh shit, I better get this tourniquet on and I better sit down before I faint. I mean, what are like for someone else, the dazed look, and, maybe you can talk about that for warning signs. Someone's gone into shock, even a kid that hit their head, right? And then how do you self-diagnose? Oh shit, I better call 911. I'm going into shock. You better send help.
Well, if any incident, you should be calling 911, especially if you're by yourself, because that might be your last phone call. Yeah. And you want someone to know where you're at. But just got, shock basically manifests, turn pallor, basically you don't have the blood volume anymore. You can basically, your heart rate is going to go up. So because your body's going to go what they call comp, that's going to compensate for the loss of volume. So your heart rate's going to go up, and then
would that
you're in trouble.
Shallow breathing, like?
Yeah.
Okay.
So, and that's why your body is compensating, and then your body goes into what they call decomp. That's when you're screwed.
Okay.
So then at that point, your heart rate stops. Your basically your blood pressure just plummets, and so forth. How do you check your blood pressure without a sigmoidometer, which is basically the blood pressure cuff, and a stethoscope?
Okay.
A good way to think about it is if you can feel the wrists, the pulse at the wrist, your blood pressure is at least 90.
Okay.
Okay. Your systolic, which is the top number.
Okay.
So and you want to go on the radial side, which is towards your thumb.
Okay. The thumb side. Okay. Here?
Yeah, thumb side. So you want to measure it there. And if you can get a pulse there, your blood pressure is 90. Okay.
Okay.
Then if you can't feel a pulse there, you can feel for a brachial,
Okay.
right in between the muscles.
Right in here?
Yep. Yeah, right in there. You kind of feel in between the muscle
yeah.
and the bone. You feel around, you can feel that.
Okay.
Then that's 80.
Okay.
And let's say you can't feel it there, then you reach down and basically reaching down in your groin, your femoral artery,
Yeah.
looking, reaching that area and trying to, then if you can feel, of course, if you can't feel it here, you're not checking your pulse after that because you're pretty close to unconscious, but someone else can check on you, on your femoral, and it's about 70 at that point. If you can get a pulse there, if you can feel the pulse there.
So there's a big, like tendon or ligament right here. Is the femoral on this side or the bottom side? Right here?
Top side.
Top side?
Yeah.
Okay.
Yeah. And kind of have to
kind of
work
wiggle
on
down,
feeling it for yourself. And yeah.
Okay.
But yep. And that's a really good idea to know what kind of blood pressure. And basically
so 90, 80.
Yep.
And if you can feel one here, it's a 70. And that's
basically 70.
And that's if these other ones you can't feel. And you're like,
correct.
Right. I can't feel one here. Shit. I might be an 80. No, don't feel one here. Oh, he's at least a 70.
Yeah.
So if someone's like
70, at least a 70, but
okay. All right, you froze
up.
up.
At that point, you're a person. Oh,
I got you. I got you
on my end.
Okay.
All right. Yeah, basically at that point, then that's bad shape. I mean, you're getting ready to go into what they call decomp, and that's when now kids, on the other hand, kids are kind of when they adults go into decomp, they compensate for a short period of time, but they crash slower. Kids, on the other hand, will compensate for a long time, but when they go into decomp, they crash like a rock, and it's bad. So decomp in a kid is scary. I can't recall the specific details anymore, but hopefully you don't get into that kind of situation.
Yeah, I know. Yeah, I know that you got some crazy stuff that happened, but so let me ask you this. How important is, I'm out hunting with some buddies, I get shot in the chest. How important is it to have a positive attitude? Because I've heard some guys or people will have like multiple life-threatening injuries and they'll make it. And then you can have someone else that suffers something that like, oh, it's just a mere flesh wound. And then they go into shock and they die.
Right. And it's funny. It's all about mindset.
Okay.
And, mindset, like Marines are the best example.
Okay.
They come in with multiple injuries, like life-threatening injuries.
Okay.
And nothing's going to stop me. And they have that attitude all the way into the OR.
Yeah.
And it's basically, it's all about mindset and your attitude, mental attitude. So, and it comes down to, you want to try to keep your blood as alkalotic as possible. If you panic and you think, oh, this is bad or whatever, you're making your blood acidotic, which is basically an unhealthy environment. Your blood doesn't oxygenate as well when it's acidotic. It doesn't clot as well, if I remember correctly.
Okay.
I know someone's going to smack me. He's like, you got that completely wrong. But there's a couple of things where basically this is really that's why the mindset makes a big difference.
So stress and panic are bad for the clotting agents and the oxygenation of your blood versus being chill and, hey, get me back out there, doc. I got some asses to kick, right?
Well, it's not so much chill. It's basically allowing adrenaline to do what adrenaline needs to do.
Okay.
And it happens better in an alkalotic environment. And just by having that positive attitude, like I got this, I'm going to kick this butt and whatever. I'm not going to let this stop me. And so forth. It does make a difference because people have died from dum-dum wounds.
Yeah. Okay.
So.
All right, man. Sweet. So those are some great takeaways. And I imagine, like some of these stop the bleed classes and stuff like that, you want to be able to put one on yourself,
Yeah.
So you need to practice with both arms and, doing a leg would be easy, but trying to do one arm, and I was just messing around. Like I tried a belt by myself, putting this on and then trying to get it tight enough. It was tough as hell. And then I tried a t-shirt, and like one of my tricks with a t-shirt, if I want to be cool, is I'll take the sleeves right here, and then I can make some really cool headband, right? But then I'm like, hey, I can use this. And then I tried to tie this. It wasn't getting tight at all, Shane.
No.
So, I was like pulling on it. I would have to try to step on this and pull it. And then I have to try to put some pin in here and try to twist it. This t-shirt didn't work.
Yeah. So what you're going to do is you're going to get it tied and it's not going to be tight. But the main thing is to make sure you get a good knot and to where you can get a stick in there. Yeah. And then you're going to get a good size stick and turn that stick around. Okay. And then some way to also then tie the stick.
Yeah.
So it stays in place. So you almost need two things, but that's just one thing you would do if you're going to do something makeshift.
Yeah. And then, just like if I was in an active shooter situation and I was in an office or something and I'm like, pow, cordage, same type thing, right? This is probably going to be a lot easier for me to get something tight, but then again, I'm going to need to tie a good knot, get a pin in there, and then crank the crap out of it. And then I might have enough extra to be able to tie the pin or whatever so it doesn't unwind.
Right. Yep.
So
yeah, it's an option for sure.
Because I've heard, well, hey, I got my belt, and then I was like, shit, this didn't work worth a damn.
No.
And I've heard shoelaces, and who the hell's got the time to undo their shoelace? If I see cord, that's probably your best bet. What does Shane's brain see when he walks into a room and he's like, possible tourniquet, possible tourniquet, possible tourniquet. Oh, that would stop a wound. Ooh, that's plastic. I could use that. So, what do you see when you just kind of, if you had to, just give me a glimpse into your brain, brother?
Oh, geez. I've worked so hard to forget all this stuff. But it, just like a DVD case, it has a perfect plastic. Cut the plastic off the DVD case, and the cover, that holds the insert. Okay. That plastic is perfect for like making an occlusive dressing.
Oh, nice.
Yep. And it's a good 6 mil plastic plus, and that's a good option. Of course, any kind of like broomstick or whatever can either be broken or whatever to make for a pole for twisting things and such. So
or
yep.
Splint, yeah.
Or any kind of a splint.
So I didn't even think about like those CDs or DVD, cases that have the little plastic. You see those in thrift stores and stuff like that. Who uses them anymore? I have some old ones. Just start cutting a bunch of those, put them in your med kit.
Right. Yep. Yeah. Put the plastic in there, and you can even roll it up and put it in a larger pill box. And have like 3 or 4 sheets of it. and it's ready to go.
Yeah, and then it's compact, waterproof. Well, I mean, it's plastic, but
Yeah,
no,
but
that's good, man. I like it. I like it. These
Yeah.
are gems, Shane. These are gems. I like it. So I appreciate your time. I learned a lot. I wrote some stuff down. Do you have anything you want to add before we close this out? And I thank you profusely for your time in this kind of ad hoc. Shane and I asked him yesterday, and he's like, let's do it tomorrow. I'm like, okay, badass. So anyway, I appreciate it. But any other words of wisdom you got when we kind of close this out, and, you know, any advice for any folks out there?
yeah, don't get hurt in the first place.
Yeah. Don't get shot.
Don't be a dummy.
There you go.
But if you are a dummy,
Yeah.
stuff happens.
Know how to rescue yourself if you had to, right?
Who was it? John Wayne. Life is tough. It's even tougher when you're stupid.
There you go. That's it. So if you're going to be stupid, at least be smart and plan ahead for when you are
Right.
stupid. You can maybe save your own ass and be your own cavalry, right?
Yeah, if you know you're slightly accident prone, you really want to listen to this stuff and maybe take some actual courses or something. But
Yeah, absolutely. And then I'll probably throw some stuff in here, but I did a little bit of research, but like there is the CAT tourniquet, which is the combat application tourniquet. It's got Velcro, and then it's got a little stick already in there, and you can wind it, and then it has a little notch where it can catch. There's the Committee on Combat Casualty Care that endorses that. Then I also heard there's the TCCC or TCCC, which is the Tactical Casualty Combat Care. They endorse a couple of different tourniquets out there, but hey, they're out there, and they're not like it used to be, where if you apply one, someone's automatically going to lose a limb. But
Right.
I do appreciate the, hey, for the layperson, single bone, and you know, if someone's a little more skilled, then they can start worrying about the 2 bones in the lower leg or the 2 bones but
right, yeah.
sweet.
And you know, the tourniquets have also come a long ways, and it really, that's the best thing. I mean, it's cheap insurance. It really is,
Yeah.
considering, and the fact that it's going to save your life, and potentially because of the way it's designed, that's why it actually save your limb as well.
Yeah. But before that, you know, direct pressure and elevate, right? So, you know, and then
first.
Yeah, there you go.
Yep. Let's work up. Let's not go to the bazooka right away.
There you go. Well, brother Shane, as always, man, you are my first double guest, man.
Yep.
So you were number 6, and you just beat everybody. You're number 1 double, my double date, buddy. Hey, man, I appreciate it. Tell your beautiful wife I said hello. Give her a hug. Give the girls a hug for me. And I can't wait to hang out with you again soon and visit with you soon.
Awesome.
All right,
Thanks.
brother. Thanks, buddy.